What if the very medicine you trust could silently harm your brain? It sounds unbelievable, but new research suggests that some common drugs may actually raise your risk of developing dementia. In this video, we'll uncover 5 types of medicines that experts have linked to a higher chance of memory loss and brain decline. Stay tuned till the end, because this information could affect you or someone you love. Before we begin, let's quickly understand what dementia really is. Dementia isn't just forgetting names or misplacing things. It's a serious condition where memory, thinking, and daily activities slowly become harder over time. It can affect personality, emotions, and independence. Many factors can cause or increase the risk, such as age, genetics, and lifestyle. In recent years, doctors have raised a new concern. Some commonly used medicines might also play a role. Now, we're not saying these pills always cause dementia, but the research is strong enough to raise a serious warning. Let's take a closer look. So, how can a simple medicine possibly increase the risk of dementia? It all comes down to how certain drugs affect the brain. Some medicines work by changing the balance of brain chemicals or by slowing down brain activity. Others affect blood flow or build up in the body over time, especially in older people whose systems clear medicines more slowly. One key chemical is called acetylcholine. It helps the brain with memory, attention, and learning. But some drugs block this chemical. Harvard Health and PubMed studies show that when acetylcholine is blocked for long periods, the brain's ability to form memories drops, and brain cells may start to weaken. Other medicines, when used for years, can quietly build up in the system. This long-term exposure puts extra pressure on brain cells and raises the risk of cognitive decline. The message is clear. It's not about 1 or 2 pills. It's about long-term use, high doses, and older age. That's where the real danger starts to appear. Medicine type number 1, anticholinergics. The first group on our list is called anticholinergics. That sounds complicated, but here's the simple truth. These are medicines that block the brain chemical acetylcholine, the same one that keeps memory and thinking sharp. Harvard Health reports that people who used anticholinergic medicines for more than 3 years had about a 54% higher risk of developing dementia. These medicines include older antihistamines like Benadryl, diphenhydramine, bladder control drugs, and older antidepressants known as tricyclics. The National Center for Health Research also warns that long-term use, especially in people over 65, can lead to lasting memory and concentration problems. If you or a loved one have been taking these for years, don't stop suddenly, but do talk to your doctor about safer options. Medicine type number 2, benzodiazepines and sleeping pills. Next are the benzodiazepines, medicines like Xanax, Valium, or Ativan, often used for anxiety, stress, or sleep. They calm the brain by slowing its activity, but when used too long, they can also slow memory and thinking. According to Harvard Health Research, people who took these medicines for 3 to 6 months had a 32% higher risk of Alzheimer's disease, and those who used them longer than 6 months had an 84% higher risk. The reason is simple. They depress brain function and may interfere with how nerve cells communicate. These drugs are meant for short-term relief, not long-term use. If you've been taking them for months or years, ask your doctor about a safe way to reduce or switch your treatment. Medicine type number 3, painkillers, opioids, and analgesics. The third group includes strong painkillers, especially opioids and some long-term pain medicines. According to PubMed studies, people who rely on these drugs for years may face a higher risk of memory problems and dementia-like symptoms. Not all painkillers are bad, but stronger or long-term opioid use can slow brain function and cause chemical changes over time. It's important to remember, pain control is necessary, but there are often safer alternatives. Talk with your doctor about balancing pain relief with brain protection. Medicine type number 4, proton pump inhibitors, PPIs. Acid reflux drugs. The fourth group might surprise you. Acid reflux or heartburn medicines, known as proton pump inhibitors or PPIs. These include popular brands often taken daily for years. Research published by Verywell Health found that long-term use, more than 4 years, was linked to about a 33% higher risk of dementia. Scientists believe this may be related to reduced absorption of vitamin B12 or changes in brain metabolism. Now, the link isn't as strong as in other drug types, and it doesn't mean PPIs directly cause dementia. But the takeaway is clear. Don't use them longer than needed. Use the lowest effective dose, and consider lifestyle changes like diet control and managing reflux triggers. Medicine type number 5, antipsychotics, anti-seizure, bladder and Parkinson's drugs. The fifth group includes several powerful medicines used to treat conditions like psychosis, seizures, Parkinson's disease, and bladder issues. Studies from Healthline and MDPI show that some of these drugs also have anticholinergic effects, which can interfere with brain chemistry and memory. These medicines are often essential. They help people manage serious health problems. But when used long-term or in combination with other brain-active drugs, they can raise dementia risk. That's why you should never stop these medicines on your own. Instead, talk to your healthcare provider about regular brain checkups or possible alternative treatments. So let's recap. The 5 types of medicines linked to dementia are anticholinergics, benzodiazepines and sleeping pills, strong painkillers and opioids, proton pump inhibitors, and certain antipsychotic, anti-seizure, bladder, and Parkinson's medicines. This doesn't mean these pills always cause dementia, but research clearly shows a higher risk, especially with long-term use, high doses, and older age. Your best move is to review your medicines with your doctor, understand why you take them, and see if safer alternatives exist. And remember, your brain health depends on more than medicine. Good sleep, regular exercise, mental activity, and a balanced diet all protect your memory too. If you take any of these medicines, don't panic, but do talk to your doctor. Knowledge is your best defense. Share this video with your family and friends. It might help someone realize what's putting their brain at risk. And if you found this helpful, make sure to like, share, and subscribe for more real health alerts. Because your brain is precious. Don't let a pill you've trusted for years quietly raise your risk. Stay informed. Stay safe. Stay healthy.